So, with the dawning of DIY dentistry, it might sound cool, it might sound cheap, it might sound easy, but unfortunately, there are risks that most patients don't know because they don't communicate that very effectively. And at home DIY aligner solutions, for example, can actually cost you more money in the long run because of corrections. You have to go see your dentist anyway to get you where you want to go because there's no support there. But also, it can cause irreversible or long term damage to your mouth and your teeth and your gums that many patients don't realize, whether that is, recession or unsatisfactory bite, of course, the smile that didn't turn out the way you wanted it to. And then in extreme cases, which you don't hear this very often, but definitely our reports is that some people have lost teeth because of it. And that's just the structure around the teeth. There was an underlying problem that wasn't addressed prior to moving it. And unfortunately, the tooth had to come out or it came out on its own, which is scary. There are a lot of advantages to clear alignment, clear aligner programs outside of just the aesthetics. And I don't want to lessen the aesthetics, that's still very important. And ultimately, a lot of patients come to me and they're like, oh, I'm not vain. Oh, I don't care about my smile. I can tell you of multiple patients that are up there in years and they decided to go forward with it and they have no regrets because they get compliments at the restaurants or the golf course or their place of worship. And it's just really great to see. So, definitely aesthetically is a huge reason to do it. But oftentimes, when patients, especially, are not truly not concerned with the way their smile is, they just want their teeth to last. There are plenty of advantages, such as a better bite. It feels more even. The forces are hitting where they're supposed to. And in turn, that actually prevents recession of the gums. It prevents tooth wear and tooth cracking and chipping because everything's in harmony. Also, strictly from having the teeth in the right position and all aligned, it makes it more enjoyable to keep them clean. We call it raising your dental IQ. So you're more in tune with your mouth and how it feels, and you're able to just keep it cleaner. Statistically, they've done some studies out there that just by having aligned teeth, even if your home care is not as good as where it should be, you're statistically less likely to get gum disease and cavities compared to someone who has misaligned teeth or crowding because there's just so many more nooks and crannies for things to happen undetected that you're just not aware of. So, the process of clear aligners from start to finish. You come to see us for a consultation. We talk to you about the advantages, potential disadvantages of going through with the clear aligners. If you say yes, then we take some photos. We take the intraoral scan, which is digital. There's no goop impressions, so it's much more enjoyable and pleasant for vast majority of patients. Then we have custom treatment planning. We at Northstar use board certified orthodontist in conjunction with all of our cases. So you're getting two sets of eyes, not to mention the other docs on the team as well when we have interesting cases. But no matter what, all of our aligner cases are planned with a board certified orthodontist. And then it comes down to the delivery day. You come to see us, we go through how to use them, walk you through expectations, as well as if there's any buttons or attachments that go on the teeth. There are little clear buttons made of composite, which is that filling material that we use for fillings. Sometimes we have to modify the tooth shape a little bit just so that they move by each other and restack nicely, aesthetically and functionally. And then it's off to the races. You come to see us every 6 weeks, unless we're doing some weekly photos with you, which can reduce your visits, which is a great system as well. And then the process of the physical process of the clear alignment of how teeth actually move is sequential slight changes in each tray over time. And most people change them weekly. Some people every 10 days, some people every 14. Depends on your custom treatment plan, of course. But there's little connectors called the ligaments that connect your tooth to the bone. Those, without moving, are short. And then once you apply pressure, they stretch. And so sometimes people feel a little bit of a loosening of the teeth, especially when they're chewing or talking without the trays in. But it's not to worry because we've already measured your gums. We've already made sure that there's an absence of disease on the gums, and those are expected. And then there's little cells that remodel the bone as the teeth move into their correct position or the desired position, that remodel, repair, clean out the dead stuff, if you will, and then lay down some fresh bones so that when that tooth does get to that position, that better planned position, then it starts to create that new bone in that area to help keep that tooth where it's supposed to go. The teeth have moved into the position that we want them to go. Then we wear retainers, and we want to make sure that we're wearing our retainers regularly, aka nightly for most patients, because it's like a reminder for those ligaments and those cells to keep those teeth where they're supposed to be. If we forget to wear a retainer for a long time and you try to put that back in, it doesn't feel great. And that's those mini changes that add up throughout your day, your week, as you're talking, chewing, swallowing, because believe it or not, those are forces too. And so that can change and shift where your teeth want to sit. So having that retainer is crucially important because of that regression. You don't want to waste all that time and money by not wearing your retainers. Gum recession is definitely a risk when it comes to moving teeth. You want to make sure that you're screened at the dentist for any gum disease, the presence of your existing recession, if you have any, because those things can be compounded if teeth are moved in the wrong position or too quickly, which with clear aligners, they're so gradual that you're not going to have movements that are too quick. Unlike with traditional braces, which again, not knocking traditional braces, but with clear aligners, that tray is not going to be able to move those teeth too quickly. If there is existing recession, and you move a tooth too far forward or towards the cheek or the lip, that can actually make the recession worse, which obviously we don't want because it means likelihood of being referred to the periodontist or the gum specialist because you might need a graft. So all of that is to say, get screened first, get that exam at the dentist before you dive into anything with clear aligners because you want to make sure that you're doing your due diligence. These are your teeth and your oral health. It's worth that for sure. On the other hand, I've had a few cases where we've improved their recession. We've actually moved that position into a better, healthier spot of that tooth. And we actually reduced or made it less likely for sure at least that recession is going to continue, and that's just by aligning those teeth in the better bite so that it's not so traumatic and that those forces are the correct type of forces for that specific tooth so that that recession doesn't get worse. We are really finding a lot out about airway, sleep, and tooth alignment in this era of dentistry. Lots of research is coming out. There are people out there that strictly have practices dedicated to airway treatment in the dental field. There are appliances, scans, screening. It's such a big and comprehensive picture. And we at Northstar are so committed to being forward thinking with that. We need to make sure that we're evaluating top to bottom. You're not just a set of teeth. You are a full person, both from a personality and relationship base, but also from, you know, your jaw, your mouth, your airway, what you're going through medically. All of that is tied and it matters when we're talking about that airway TMJ connection. We screen by looking at your throat score, also known as a Mallampati score. We look at the tongue size and the position of your tongue, whether there's scalloping on the side of your tongue, whether you have tooth tipping towards the tongue, facial asymmetry. All of these can clue us in to a potential airway issue. And in our method of treatment planning, we put airway problems at the very top. Whether you do something about it or not is completely up to you. Just know that it can affect those later parts of your treatment plan, those later phases, because there's an overlying airway issue. And so we always start up here with airway screen for that, refer for treatment or treat in office, depending on what it looks like. Talk with your medical professional. We're an open book. We often get calls from a medical doctor or an ENT. We work specifically with a few ENTs out there, ear, nose, and throat doctors that are really keen on making sure that we're treating these airway issues in conjunction with what it looks like dentally. So, a clear aligner consultation at Northstar starts with a conversation, right? What goals do you have when you're considering aligning the teeth? Making sure that those are checked off for sure. And if they can't be achieved to the level that the patient wants or the patient expects, or we don't have the level of skill, we have a great team of orthodontists that we work with and orthodontic specialists that we work with in the area, that have a long-standing positive reputation in the community. And we've been referring there for years. So if a patient does feel, if we feel the patient needs to be referred, we absolutely will do that for those complex issues. Now, if it's something we feel is treatable in our office, again, we work with board certified orthodontists on all of our cases. We can treat a lot in office. And so that conversation is the number one thing that we start with, to discuss goals and discuss expectations. Then we go and do a scan, a digital scan. There's no goop, which is always fantastic, a big win for the patient. And we get to speak for that scan during our consultation. Hey, your bite looks a little uneven here. Hey, you have an overbite that's causing premature wear. You're in your 20s, 30s, and this wear is not normal. It's actually pathological. We need to correct for this if you don't want a smile that looks more aged than what your actual age is. And then, of course, going through any areas of recession, areas of uneven bite, open bite, tight bites that we can all correct. And then after that, we go through kind of the highlights of what it means to go through aligner treatment. And then, of course, finishing up with the financial aspect, whether there's insurance coverage, no insurance coverage, going through our financial payment options, and just being very upfront with all of that so that the patient can then make that decision either that day or at a later date when they've talked to their significant other or gone through what is important to them. For someone such as myself that had braces as a child, teenager, and then went along in life, went to college, lost their retainer, or whatever, what have you, right? It is definitely not too late. In fact, a lot of our patients are in this position. They are grown adults. They are embarrassed of this rotated tooth or the crowding on the bottom, or it's annoying to have to clean, or there's really tight spaces that flossing just isn't fun. Those are great candidates for clear alignment. In fact, a lot of my patients are in that position. I was in that position. I went through clear alignment because of that. Getting food stuck in weird places, of course, right in the front. So, definitely a big driver to try to reduce that. But braces aren't sexy for adult patients a lot of times. And that's a barrier for them. Or they are a lecturer or talk in front of people at work or are a school teacher or on camera. These are really great advantages that clear alignment has because you can pop out your tray, give your speech, talk to your students, talk to the people of Denver on a broadcast or something, and then pop them right back in. Taking family photos, you don't have the metal on the teeth, so it's generally more aesthetic, and that's a great option for a lot of patients who have that concern.